Now, as we told you, federal and many state workers will be required to get weekly COVID tests if they're not vaccinated.
So we have a lot of questions about that, especially who is going to pay for all of those tests. New at 11, CBS 17's Amy Cutler digging deeper into that for us tonight. Amy, what were you able to find out about this?
Well, Rod, it is clear it will be the taxpayers footing the bill for all of this, but the price of it is still unclear. There's still a lot of moving parts, but as one economics professor put it to me, the cost of not doing anything is likely much higher.
The governor will soon require all state employees and cabinet agencies to show proof of vaccination or undergo regular COVID-19 testing. These are the employees under his purview. That's nearly 55,000 permanent employees and 4,000 temporary ones. The state tells me it's unclear how many have been vaccinated since they haven't kept track.
If people don't want to get the vaccine, then they should have to take extra measures to ensure that they are not endangering the people around them.
There is a cost associated with each one of these tests, and they vary widely. For those without insurance, Duke Health charges $39. At UNC, it costs $100. The state didn't answer my question about how much they pay for a test.
Having COVID is way more expensive than testing. People need to get vaccinated in order to make sure that this doesn't happen in the future. And if testing is going to be a stepping stone to making sure that that happens, then I'm all for that.
I went to NC State economics professor Dr. Michael Walden for insight. He calls the increase in cases concerning.
From an economic point of view, this is worrisome.
He reminded me of the COVID-19 relief funds.
The federal government did allocate a lot of money. And so, for example, when something like the testing cost comes up, there's money out there.
It is important to note we don't know the specifics of either of these policies, either the state or how it will work at the federal government. That's another part of this. We don't know how often these workers will be required to be tested, or if they'll have to do it on their own, or if they'll have testing at work. So it's a lot of uncertainty at this point. For the state level, I'm told that they will have a policy out by August 13th. Live in Raleigh, Amy Cutler, CBS 17 News.
All right, Amy.